Hey folks, Dr. Joe Esposito here. So glad you could join us today. We're going to cover two topics today. Number one, and this is something that people ask me all the time. Well, Dr. Joe, I don't know how you can stop eating meat. I can't stop eating meat. So we're going to talk about what happens to your body when you stop eating meat, the good, the bad, and the ugly. Then we're going to talk about, if we have time for a second segment, we're going to talk about what happens when you eat more plants. Okay, so it's kind of going to be a lot of fun. So a lot of physiology in this one. A lot of fun facts, though. As always, you're always going to walk away from a show going, I did not know that. So some people say it's hard to give up meat. They don't want to give up their bacon. They don't want to give up their ham and their turkey and their roast beef. Now, I used to be normal. I used to eat meat long time ago. And it took me a few months to make my final decision. And I had to really do some soul searching and say, am I going to do this or not? But on December 25th, 1986, I had spare ribs. I was at my mother and father's house. I had spare ribs, and I drove back from New Jersey to Georgia because I was so poor. I was delivering pizza at night to pay the rent on my office during the day because I didn't want anybody to. I had no patience, and I was always afraid I have to deliver pizza to a patient. That'd be my biggest fear. Like, here, Garrett, here's your pizza. I'll see you Tuesday for your appointment. But girls got to do what a girl's got to do. So I was delivering pizza at night, seeing patients during the day, very few patients, and working really hard. And one day I woke up and I felt really good. And I thought, why do I feel good? I always have a runny nose. I always feel tired. My eyes were always puffy. So I thought, So next day I woke up, I felt really good. And I thought, how is this happening? So I started writing down what I eat, which is what I was telling my patients to do as well. And I realized at the time that I had given up gluten by accident. I just had not had any breads, cookies, cakes, donuts, pastas. So then I decided, let me put this to the test. I had some pasta, felt horrible the next day. So it was kind of my impetus to go into this. But when I was driving back from New Jersey on December 25th, 1986, December 26th, I couldn't afford meat. I was so poor that I would go to a grocery store called Metro Grocery, and I'd buy dented cans of food, torn bags of rice, ripped up bags of beans. And I would even bicycle. I had a bicycle at the time. I didn't want to drive my car. I didn't want to use gas. So I'd bicycle to the grocery store and had a newspaper delivery bag. I used to be a newspaper boy. And I started feeling really good again. And then I started saying, wait a minute, food really has an impact on your health. So I decided at that moment that I was never going to eat meat again. That's when I decided to go vegan. And so giving up meat, I'm going to tell you what happened to me. Well, I just kind of did tell you what happened to me. Had more energy, lost weight, digestive system got better, felt better. I'm assuming my breath freshened because most meat eaters have pretty rotten breath. And I came to the realization that this was really worth it. So you might think it's hard to give up, but if you don't give it up, you're going to increase what's called the inflammation in your body. The cells become inflamed. And with inflammation, this could raise your chance of getting cancer, diabetes, obesity. We're going to talk about all that. And processed meats like bacon, deli meat, hot dogs, they really are the worst of the worst. And they're loaded with nitrates and nitrites. If I have time, I'll cover that today. So one of the things that happens, I always said, your gut gets better. Research has shown eating a lot of processed foods and refined grains impact your guts. Now you're thinking to yourself, well, my gut is just a tube. It goes in, it goes out. No big deal. It's amazing what your gut can do. Think about this. You can eat a little square hamburger on white bread, and the body somehow has the miracle powers to convert that into eye tissue or liver or spleen or blood. And so your body is amazing how it can survive. And if I look at the grocery store, I see what some people eat. I'm just amazed that their brain can function. And I'm thinking how much better their lives would be, exponentially better, if they just did something as simple as ate a carrot. Had a salad. I just had a salad before I came on the air today. I'm like checking my teeth, make sure I don't have spinach in it. But if you do something as simple as that, what would happen? What if they just did something simple like took Super Greens and Essential Source, which are two supplements that I take every day? And they're on the website, drjoe.com. What would happen if they just took Super Greens and Essential Source? Or if they just had a salad? Or if they just cut back one serving of meat a day? Things would happen dramatically to improve their health. And one of the things is the bacteria in your colon are breaking down this meat. And the number one consumer of energy we have as humans is sex. The number two consumer of energy we have is digestion. And the hardest thing to digest by far is animal proteins, meats and dairy products. And so if we do that alone, we're going to have a ton of energy. I was just on Eric Von Hessler's show. I do a guest spot on his show every week, every other week. And we were talking about that, and he always, bust my backside. I'm trying to give the right word here on the air, because I'm older than him. And I remember years ago when we first started working together, he said to me one day, he says, "Wait till you're as old as I am, you'll see." And I said, "Eric, I'm 4 years older than you." He said, "You are not." And so he always plays to that, how much younger I look than him. So a lot of that has to do with gut health, because the gut is the driving system for your immune system. Food is broken down, it's absorbed, waste products are passed out. The gut is so important. Like I said, you take a square hamburger, it becomes eye tissue. The gut is the thing that makes all that happen. So you change the bacteria in your colon, you're going to lower the inflammation in your body, and that's going to lower your risk of diseases. Some people say, "Doc, if I give up meat, I get tired." Well, what happens is meat is exhausting. It uses a lot of energy, but it's also a strong acid. And strong acids are stimulants to the body, just like coffee would be, caffeine. And so you're getting artificially stimulated. So when you stop eating the meat, you might have a little period where you're a little tired. That's okay. People say, "Well, I'm going to go anemic if I don't eat meat, because meat has blood in it and blood has iron in it." Well, that's true. But what will happen is, we got to think about it, where do the animals get the iron to make the blood? They get it from eating plants. So anything red, anything green, that's going to be loaded with iron. So red beans, green beans, lettuces, anything red or green, strawberries, cherries. So you're going to get lots of iron from eating a plant-based diet. I give blood on a regular basis. Every time they check my iron, they say, "Wow, your iron is perfect." It's very rare we find somebody who has perfect iron at your age. And I say, "Well, that's because I eat vegan." And inevitably, someone at the, where I'm donating the blood will say, every time we see a vegan, their blood is almost always perfect. So it's kind of cool. There's a lot of evidence here that what we're doing is right. But one of the things you got to do is cut out the meat. So I don't want you to think about I'm giving up the meat. I'm thinking that's one less thing I have to worry about. I don't have to worry about buying meat, cooking meat, storing meat, preserving meat, freezing meat, unfreezing meat. It's a whole lot easier not to eat animal proteins. Let me tell you, I've been doing it for 34 years now. It's well worth it. But what will happen is eventually your energy will come back again. So if you do get a little tired, it's just because you're not getting all that stimulant. It's kind of like coming off coffee. Come off coffee, you feel tired for a couple of days, but then your body reboots itself and you feel great. Now, when you give up meat, meat is very constipating. And in fact, most people in their gut have about 10 to 15 pounds of undigested meat, rotting meat in their colon, because the meat doesn't have fiber. And the way the colon works is the colon is a tube of muscle. And when you put fiber in it, the muscles swell up, and then they have something called stretch receptors. The stretch receptor in a colon fires off and causes the muscle to contract. That's how food moves along your colon. Fiber is key to that. If you're not eating enough fiber, it's very difficult to pass things through your colon. And that's why it's going to take you a long time in the bathroom. You're going to save a ton of time, if nothing else, because the bowels are going to be working a lot better than they were before. So fiber makes it easier to go to the bathroom. It flushes out your colon. It flushes out waste products. Because what happens is your liver breaks down waste products and creates something called bile and cholesterol. Those foods then get passed out they go through the gallbladder into the colon and get passed out. If you're not passing things out with fiber, those toxic chemicals, like even cholesterol, can be reabsorbed back into your colon. And that's putting more cholesterol into your diet. So not only eating the cholesterol getting absorbed the first time, it can get absorbed a second time or a third time, I guess. So it's really important to increase that fiber content, because A, you're going to go to the bathroom better. You're going to feel a lot better. You're going to have a ton more energy. Your breath will freshen. And here's the thing, too. I talk a lot about this breath thing. But there's two types of bad breath, generally speaking. One of them is a rotten tooth. And you kind of know that taste. Maybe you've had an infection in your mouth. You kind of suck on it. You go, "Oh, I know that flavor." That's what smells like a rotten tooth. But most people, when they have bad breath, it's coming from their colon. So when you eat meats and dairy products or heavy proteins, they're going to sit in the colon and they're going to putrefy. When they putrefy, they give off gases. Those gases are in the colon. They can either be passed out or they can be exchanged through the colon wall. The gases can get into the blood system. Then those toxic gases can get up into your lungs, where the gases are exchanged again and they're passed out. And that gives you that potty breath. So I know if somebody has rotten breath, the first thing I want to do is I want to fix their stomach. And I've had people and friends and people I've known, and I'll say, "It's time for me to adjust your stomach. I know it. I can smell it." and you adjust their stomach, and it's like night and day. It's crazy. So the meat really puts a strain on your digestive system, which really puts a strain on your overall health. And so you really increase your risk of cancer, colon cancer especially. You also increase your risk of diabetes if you eat meat. If you give up meat, which is what we're talking about today, you lower your risk of diabetes. Researchers have linked red meat and processed meats to higher chance of getting type 2 diabetes. One study found that eating a half a serving of meat, that's a serving the size of a deck of cards. One serving is a deck of cards. So half of that is going to increase your risk of getting the disease, diabetes, by 48%. So I watch these, I'm going to get political for a second. I watch these commercials and I watch these, we're going to have raise money for the Diabetes Foundation, the Cancer Foundation, and Crohn's and colitis and irritable bowel syndrome. Nowhere have I ever seen a commercial saying, did you realize if you eat just a half a deck of cards of meat a day, you increase your risk of diabetes by 48%? I have never, in all my life, seen a commercial saying that. So we don't necessarily have to raise more money to fight these diseases. We have to stop causing these diseases. And we stop causing them almost always, in most cases, with diet. You change your diet, you lower your risk of getting disease. It's just that simple. I don't know how to make it easier for you. So you want to sit down to a ham and cheese sandwich this afternoon or tonight or whatever you have ham and cheese sandwiches, and you think to yourself, oh, Dr. Joe, I just love my ham and cheese sandwich. Understand, you're raising your risk of multiple diseases, just diabetes alone, by 48%. Why would you do something that insane? And if you have diabetes, why would you continue to feed that fire and increase your risk of making that diabetes worse? It makes absolutely no sense. So when you cut out meat, you do lower your risk of diabetes. You lower your cholesterol as well. Now, there's something called LDLs. So what happens is LDLs go out into the blood, and then they can oxidize. They can essentially go bad. And when they oxidize, they stick to the artery walls. And that's what that low-density lipoprotein oxidation causes cholesterol to build up. And I just saw a study the other day. I should have brought it with me, actually. But they did a study on stents, heart stents. And they wanted to find out the success rate of heart stents. You know what the success rate of heart stents is? 0. They don't lower your risk of having another heart attack. They don't lower your risk of dying, heart attack in that area. They don't lower your risk of dying. And they're very expensive. Of course, the surgery itself is dangerous. And essentially, no change between people that had stents put in and people that didn't have stents put in. And there's study after study after study showing that. Now, the only thing that might help is with pain, but several studies have shown that doesn't really change that either. Why? Because if I have a blocked artery in my body and I put a stent in there, a stent is like a cage that opens up the artery. That's great, but what about the rest of my body? There's never arteriosclerosis or herniated arteries that's localized. It's always systemic. It goes through the whole body. And so what happens is many times it's not the area that we see the blockage in that caused the heart attack. What happens is the cholesterol can build up, cause an inflammatory reaction, and eventually that inflammation can become so great that the body now has to send in more cholesterol to act like a scab over that area. And if that area bursts, pops open like a pimple, then you have this clot floating through the body, and that clot can clog up the arteries and stroke or heart attack or lungs. So it makes no sense. I sit and watch these commercials and these fundraisers. I remember seeing a while ago a fundraiser for cancer. You know what kind of fundraiser it was? A bake sale. Bake sale for cancer. What does cancer love? Sugar. And I just lost my mind. I'm like, I understand we got to do research. I understand money's necessary. But the way we're going about it just doesn't make sense. And that's the thing that drives me nuts. So by giving up the animal products, you lower your cholesterol level. And experts say saturated fats make up less than 10% of your calories every day, should make up. If you still crave meat, you need to get over that. Okay, you might crave alcohol, you might crave cigarettes, you might crave sugars. It's all a part of your brain called the nucleus accumbens. If you go to our website, drjoe.com, you can listen to a show we did on addiction. And the website's great. drjoe.com has over 1,500 hours of podcasts, audio and video. So type in what you're looking for. I don't the big ones are diabetes, blood pressure, heart disease, weight loss, men's health, women's health, pain management. And those are some of our most popular shows, but all our shows get a ton of hits. So if you go to website, drjoe.com, whatever your health issue is, type in what you're looking for, and I think you'll be amazed at how much research is there and how you're going to say, oh, there is an answer to most healthcare problems. Not all, but most. And lowering cholesterol, of course, is a biggie. If you take statin drugs, sometimes you need them. How often do you need them? Studies have shown that 1 in 100 people have genetically high cholesterol. 99 out of 100 can manage their cholesterol with diet. So if you're taking cholesterol, just because your father had high cholesterol doesn't mean it's genetic. It means you ate the same food your father ate. So there's a predisposition to it, but you can alter that predisposition simply by changing your diet. Not hard. And the number one thing you do is give up animal products. It's real simple. If you start eating more plants, you're going to save a ton of money. I cannot tell you how many patients have come to me over the years and said, Dr. Joe, I can't afford not to come see you as a patient. Because we offer chiropractic and medical services. So chiropractic is the number one treatment for pain. So neck pain, back pain, shoulder pain, chiropractic is most effective, least expensive. They will tell me, gosh, every time I go see my other doctors, it costs me this much money. I can see you guys for a whole year. And it's cheaper in many cases. And in fact, Jake and I were just talking about doing some social media posting. And he said with workers' comp cases, 47% of work comp cases that went to a surgeon got surgery. 1.5% of the people of work comp cases with back injuries that went to a chiropractor got surgery. So if nothing else, you save a ton of money. Why wouldn't you want to save a ton of money on your health care? And the easiest thing to do is start with chiropractic for pain. Diet-wise, again, you're going to eat things like beans and lentils and salads and fruits and vegetables and nuts and seeds, way cheaper than alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. So you'll save a ton of money. I have patients tell me all the time with supplements, Dr. Joe, I can't afford not to take your supplements. Because they do minimum supplements everybody should be taking, by the way, are Super Greens and Essential Source. They're on the website, drjoe.com. If you're looking for energy, I recommend B-complex, adrenal support, and nitric oxide. Don't take nitric oxide if you have low blood pressure. And people, when they start taking supplements, they're like, oh my God, I'm not drinking coffee. I'm working harder. I'm staying up later. I'm enjoying my life. My love life is improved. I'm enjoying my family. I'm able to enjoy the weekends and not just crash. I can't afford not to take your supplements. Here, there, all the time. Just had a medical doctor just yesterday, and he says, I don't know why I waited so long. He says, you're right. I hear it say it on the show all the time. You know, the biggest complaint I get is, why didn't I do this sooner? He says, and you are absolutely right. I've never been to a chiropractor. You guys have totally changed my life. He refers patients like crazy now. He says, I don't know why I didn't do this sooner. That's all it took? Yes, that's all it took in most cases. So, again, we're talking about what happens if you give up meat. Again, you save a ton of money, too. You help the environment. If you're environmentally concerned, that's a biggie. The only supplement that you're not going to get, well, I take supplements every day. I take Super Greens and Essential Source, but you got to make sure you're getting B-complex, especially B12. Because what happens is B12 comes from bacteria eating, put it simply, dead animals, rotten flesh. So when the bacteria eat the animals, they spit out B12. Now, your colon has bacteria in it, too, and they can produce B12. But I do recommend that you make sure you're getting supplementation. Whether you're eating a meat diet or a plant-based diet or a raw food diet, I would definitely recommend at least Super Greens and Essential Source. In the winter, you have to take vitamin D. I don't care who you are. If it's wintertime, you're not getting full sun, you're not on the equator, you need vitamin D. I take adrenal support because I have a stressful life. Good stress, but it's stress. Nitric oxide opens up your blood vessels, increases circulation, helps your brain work more efficiently. Ton of energy with that. Omega-3 fatty acids, my gosh, they're called essential. Why? Because they're essential for your health. I take omega-3 fatty acids as well, and I take some other ones as well. I take a digestive enzyme every time I eat a cooked meal. So all the supplements are on the website, drjoe.com, but the starter pack, minimum, Super Greens, Essential Source, vitamin D, and I would probably say B-complex to start you out. But again, you can customize your plan. On the website, we have all our supplements listed. You can kind of customize your own plan, which makes it nice. And if you have a health issue, why don't you just come see us? We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. We have chiropractic and medical. Medical is regenerative medicine. We have PRP, exosomes I've had put in my body already, amazing results. If you don't know what these are, go to our website, drjoe.com. It says services. Just look them up. It explains what it is. But PRP, really, really popular for arthritis, knee injury, shoulder injuries, regenerative torn muscles. It can regenerate the body in many cases. Erectile dysfunction, women with sexual dysfunction, leaky bladder, you can use PRP there as well. And again, all that's listed on the website, drjoe.com, under services. But if you have a health issue, neck pain, back pain, shoulder pain, digestive issues, nutrition issues, if you really want to get in there and get to the cause of the problem, not just treat the symptom, go to our website. You can book an appointment right now on any of our offices. You can do it right online. The initial visit is normally $375. We've reduced that to $199. We're not going to do that forever. We're going to end that when COVID ends. It includes exam, x-rays, consultation, your first adjustment, going over the x-rays, and the nutrition evaluation. And then from there, we're going to put together a treatment plan for you. We accept insurance after that. We accept people with all insurances. It depends if your policy covers or doesn't. We always try to match your benefits no matter what it is. If you've ever been in a car accident, ever, if the car was damaged, you were damaged. You need to come see us as quickly as possible. So if you're sick and tired of being sick and tired, drjoe.com. Book your appointment. The supplements, by the way, we can deliver to you. You can order them right online, or you can come by our offices. Pick them up. Save some shipping. Joe is a guy who does our shipping. He'd love to have to do less work. So if you come by and pick him up, we'd love to see you and say hi. And then we can also get that taken care of for you. We get you the supplements. All our offices carry the supplements. I want you to follow us on social media at Dr. Joe Esposito, Facebook, Instagram, and YouTube. I really need your help on this, folks. I give you all this information, answer your questions on the website all day, every day. I'm constantly answering questions on the website, me, Garrett, and Joe. So if you have a question, send us. The website will pop up. The bot will pop up. You have a question, send it to us. But I need your help for social media. So I give you all this. This is what I ask in return. Because again, in the universe, it has to be a give and a take. I want you to just go to at Dr. Joe Esposito, Facebook, Instagram, and YouTube, and just follow us. That's all I'm asking. We send out a lot of good information. We send out information every week, every day now. We have our new social media director, Jake, and he'll be sending out information every day. And it'll be fun facts. It'll be health tips. It'll be sometimes silly pictures. I mean, it's nothing that's going to take up a lot of your time. We're going to do videos of the doctors, all my doctors working on patients. You get to meet the doctors. So it's a great opportunity for you to not just, scroll through and look at dancing kitties. You get to actually get some good information. So at Dr. Joe Esposito, Facebook, Instagram, and YouTube. And Instagram is where we need the most boost because we're trying to get to become an influencer. So we're talking today, just make an appointment. That's right, drjoe.com. So we're talking today about what happens when you stop eating meat. And one of the other benefits is you'll lose weight. Researchers reviewed 15 studies on how vegetarian diets affected your health. People who switched to a plant-based diet lost about 10 pounds, and those who were heavier even lost more. One of the reasons you're going to lose weight, and it happens pretty quickly, first couple of weeks when you go to a plant-based diet or more plants, is your colon has this rotten meat laying in the colon. And dairy products is mucousy forming, clogs up your colon. So when you start eating fiber, it pushes everything through. And many times the first week or two, you say, oh my gosh, what an amazing weight loss. You're probably not losing that much fat. You're losing a lot more of colon. Colon content will keep it clean. And your colon content flushes itself out and you start feeling great. And it's a great motivator because once you see it, you start to feel so much better. And you have all this energy coming around. So you're going to save money, better for the environment, easier to clean up. It's better for your life. You're probably going to extend your life expectancy. You're going to reduce your risk of heart disease, diabetes, and cancer. The only downside I can see to not giving up animal proteins is they taste good. I was normal once. I used to eat animal proteins, and I remember they tasted good. But to me, it's not worth it. I always say, well, look at a meal and think, would Dr. Joe eat it? If I wouldn't eat it, you shouldn't eat either. Folks, I'm Dr. Joe Esposito. Our website, again, tons of information there. Send us your questions on the website. Book an appointment, drjoe.com, drjoe.com. I'm Dr. Joe Esposito. Tell your friends about the show.